Good evening and welcome. Here is a COVID-19 special edition on Channels Television. I'm Millicent Walker. It's a 30-minute daily update at noon at 6 p.m. and a 45-minute update at 9 p.m. on the coronavirus pandemic in Nigeria and across the world. Now, first, the highlights. The Minister of Health, Dr. Osage Hanire, tests negative for COVID-19, but that of an aide to the president is positive. Federal government plans to stop interstate travel in Nigeria. And more states witness lockdown in a bid to stem the spread of the COVID-19 pandemic. We have those details. Begin with the Minister of Health, Dr. Osage Hanire, who has confirmed that indeed an aide to President Muhammadu Buhari tested positive to COVID-19 and he is being treated at one of the facilities in the country. But he did not disclose the identity of the presidential aide. Dr. Hanire was speaking at a news conference in the nation's capital, Abuja, days after news went viral that the chief of staff to the president may have tested positive. Aside the confirmation, the minister also said himself and the permanent Secretary of the Ministry of Health tested negative to COVID-19.
An aide who tested positive is receiving treatment in a secure facility. Does not need category 4 treatment. He requires only a general medical treatment. The contact tracing has been very efficiently done, and I'll use the opportunity to also tell you that there are what you call close contacts. And there's also what you call casual contact, and there's what you call distant contact. Distant contact is a no contact. Like this gentleman, like you and me now, is like no contact. Okay? Okay. There's casual contact that maybe you shook hands. And then there's close contact when you sat together head to head and had a conversation or a long conversation or whatever. So you differentiate between those ones. So if you're looking at the casual contact and also the distant contact, if you call it that way, maybe we just see each other from a distance, those ones are not critical. So those contacts have been done and the tests have been carried out. We use a test kit that is sanctioned, approved, and in fact to a large extent supplied by the World Health Organization. So it's approved, and we insist on that. There are many, many, many vendors who are offering us test kit from here, from left, from right. We use WHO accredited test kit because the result you get has to be reliable and it has to be dependable. It has to meet all the criteria for protecting our citizens. So there are people who are developing what they call rapid test kit. And the rapid test kit, they are testing other parameters. And those are the ones that are said not to be reliable, those ones. But we don't use that one here. We're not using those rapid test kits. So some of those rapid test kits are said to be unreliable, and they have not been verified by the World Health Organization. They have not been validated until they are valid. In fact, the manufacturers will tell you, when you use this rapid test kit, go and do the real test to confirm. So why do double test when one is not reliable?
In the meantime, the federal government says it is coming out with tougher measures to contain the spread of COVID-19 in Nigeria, one of which is stopping interstate travels. This is coming from the Minister of Information and Culture, Mr. Lai Mohammed, who told journalists in Abuja that many Nigerians are not cooperating with government with regards to the social distancing order. The minister also raised the alarm of looming community spread of the virus in the country, saying if this happens, the rise in cases would be exponential. He also disclosed that firefighters and firefighting equipment are to be deployed in disinfecting towns, cities across the country.
We are considering tougher measures to enforce compliance in order to stop the exportation of the disease to states that do not have it and minimize spread. Possible measures include using firefighting and other adaptable vehicles and personnel to fumigate cities and towns. We also don't rule out stopping interstate and inter-town travels except for essential services. And we do not rule out closing all motor parks and interstate rail stations. Already, all train movements nationwide have been stopped. We'll be considering and announcing new measures from time to time, but rest assured that whatever decisions we take will be in the best interest of Nigerians. We're on the verge of meeting the level of community spread. We must stop this immediately, and we will record exponential cases in the days ahead.
Now, apart from news coming in that Bauchi now has a second case of COVID-19, latest figures from the National Center for Disease Control shows that the total confirmed cases in the country at last is 51, with River State confirming its first case. Lagos and the Federal Capital Territory each recording 2 new cases. A breakdown puts the number of confirmed cases in Lagos now at 32, the FCT 10, Ogun State 3, Ekiti, Oyo, Edo, Bauchi, Osun and Rivers at 1 case each. Information from the National Center for Disease Control says that as at last night, 3 of the latest 5 cases were travelers returning into Nigeria, while 2 were close contacts of a confirmed case. Now, at the seat of power is our State House correspondent, Ibrahim Adra. We have Ibrahim for us to tell us more about what's happening in Abuja. Ibrahim, I mean, what is the secret, especially as to the number of government officials or top aides to the president who are undergoing COVID-19 tests and their status?
Oh, well, what to point out right away, Millicent, is we're happy those press briefings took place today, 2 of them, the Minister of Health and the Minister of Information, all speaking on various aspects of this pandemic. I also note the stance of the Minister of Information regarding strategy at containing the pandemic. He says it's working, but there is still more work to be done, as well as the fact that government is going to be more aggressive in enforcing the measures taken to contain this virus. And that's understandable if you take a look at town. I've been around and I've interacted with some people. I think that interruption in the citizens' way of life is yet to catch on. You still see people in close clusters. It's business as usual, if you ask me. For those who wear masks, what you see is the mask is on at one time, then the next minute it's down here under the chin, and then it goes back up. So that calls for further enlightenment, if you ask me, about how to properly use this mask. Even gloves, you see them, they are on one moment they are off. The same glove goes back in, it touches the phone and touches everything. So I don't know how effective these measures would be for the time being. But in my interaction with an official, a health official, a senior health official who is working closely with the task team on this, is that the facility in Abuja Isolation Center, because I had to ask, what is the quality of the facility when you compare that to what obtains in Lagos? And he told me it's as good as any. They have consumables, they have got items in place, they've got a place that has a little over 20 bed spaces. And he also confirmed the inmates are in stable condition, actually interacting amongst themselves. But government is working seriously towards increasing the bed capability. They're looking at facilities. One has 40-bed facility. There is a 60-bed medical center in Zubala. The government is also looking to make an isolation center, as well as a 160 facility right here in the heart of the city that may be used. They are hoping they don't have to, but if it comes to that, they are hoping these facilities would be of help as well.
Tell us briefly, just like Lagos, if I may, Ibrahim, just like Lagos, we're also hearing that there is fumigation ongoing at the presidential villa. Oh,
well, what we saw was I would think it's perhaps a normal routine of disinfecting the area once in a while. Now, because we didn't get to speak to anyone, it's difficult to say if it's a fumigation that was, organized specifically because of that, or some routine maintenance that usually happens in the villa. We couldn't speak to anyone regarding that, so no one can confirm exactly what it was that happened.
All right, well, I'd like to thank you, our State House correspondent there, Ibrahim Adra, joining us from Abuja. Here in Lagos, the commercial capital, in order to keep the environment safe, the Lagos State government is deploying disinfectant equipment to fumigate the entire state. According to information on the governor's Twitter handle, the fumigation machines will be deployed to every part of the metropolis for sterilizing public spaces. The Lagos Commissioner of Police, Mr. Akeem Odumosu, has been going around the state to enforce the directive by the state governor on the closure of all markets and stores, except those selling essential items like food, medicine, and water. Let's listen. We caught up with him earlier. Let's listen to what he had to say. I guess we're going to come back to that particular track. But we have joining us a member of the Public Health Physicians of Nigeria, Lagos chapter, Dr. Anne Okoma. Thank you so much for joining us on the program.
Having me.
All right. First, I'd like to start with the NMA. They're decrying the absence of coordination between federal and also state governments in managing the spread of COVID-19. Is that a view that you hold?
Sorry, what did you say?
You're saying that the NMA complaining that the state and federal governments, there's no coordinated efforts to, curtailing the spread of COVID-19.
Well, I think there has been some level of coordination between both the federal and the state government, but we've seen some level of foot dragging coming from the federal government at some point, and that is one of the reasons why we are here today. So it would be nice for the federal government to take more decisive and drastic steps and actions. So,
what do you think we're also learning from the outbreak of COVID-19? I know they say it's a virus that's novel, people are still learning from it, but what are we doing in terms of what we learned from the Ebola outbreak in the past?
For the COVID-19, you could see that the mode of transmission is actually very, very fast. Because this one spreads through droplets, unlike the Ebola where, you had to really have close contact with someone who was sick. But in the case of COVID-19, it spreads through droplets. So anyone could actually pick it at any point. So the mode of transmission is something that is actually very worrisome. And that is why some people are not taking it very seriously because they feel like it doesn't really exist and stuff like that. But the lesson here is that people now can see an increase in the rise of cases that we're having. So we're having now an increase in the curve. And so this now should tell Nigerians that this is no joke. Well, actually, this is actually a war situation. And Nigerians now, we need to take it seriously and then take safety precautions, take responsibilities, and then do the needful.
I have several questions like social distancing, if we can actually have that in our open market. So perhaps we'll hear from you, but we need to go on a break now. Still to come on the program is the World Health Organization on the global pandemic COVID-19. Join us again.
That has not been previously identified in humans. The incubation period for COVID-19 is between 1 to 14 days, most commonly around 5 days. Common signs of infection are cough, respiratory symptoms, fever, shortness of breath and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure and even death. Here are some basic protective measures against COVID-19. Frequently wash your hands with soap and water for up to 20 seconds. In the absence of soap and water, thoroughly clean your hands with an alcohol-based hand sanitizer. Maintain social distancing, at least 1 meter or 3 feet distance between yourself and anyone who is coughing or sneezing. Practice respiratory hygiene. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Avoid touching your eyes, nose and mouth. Greet people with a wave, a nod or a bow. If you do have a fever, cough and difficulty breathing, seek medical attention immediately. In case of an emergency, you can call the NCDC toll-free number 0800 970 00010. Lagos State Emergency Hotlines 08000 Corona 080 231 69485.
It's our COVID-19 special edition here on Channels Television. We've been talking about the pandemic in Nigeria and also across the world. And we still have our guest with us, who is a public health expert, Dr. Anne Okoma. But let's go to our correspondent in Edo State. We know that the state recorded its first confirmed case. We have our correspondent, Jessica Lugwushere, there. Jessica, it must also be a big relief for the people of the state on the negative COVID-19 result on the person of the state governor. Tell us about the mood in the city.
Hello, Melissa. Hello, could you take that again?
All right, so tell us about the mood in the city, seeing as the results of the state governor came out negative.
Yes, earlier today, there was information that the results of the rapid diagnostic test the governor took came out negative. It was negative, but the governor is still observing in self-isolation, awaiting the results of the PCR test that's concerning the coronavirus. But earlier this week, the government came up with some measures to curb the spread of the disease in the state. These measures included shutting down schools for a number of weeks. That order was given on Sunday, and as of Monday, most of the schools complied, sending the pupils and the students home. Then on same Monday, the government came up with more directives, including social distancing, advising people to observe that, and reducing the number of public gatherings, the number of persons who can gather in public at a particular spot to 50. And then on Tuesday, reduced that number to 20. That's a further reduction. Concerning marketplaces, markets from essential commodities were to remain open, while others who deal in other goods were to be closed, or sellers of other goods were to stay away from the market. But at this moment, about 2 hour market in
All right, a bit of difficulty there with the information our correspondent Jessica is bringing for us. But essentially, with the pictures we're seeing in Benin City, compliance level appears to be low. But let's go to Bauchi State. Hajar Aliyu, our correspondent there, explains the level of non-compliance in the state as well. She also gives us an update on the state governor's condition. We understand that no fewer than 27 persons in the state have been placed in compulsory self-isolation for a minimum of 14 days following contact with the governor there. And latest report is that there is now a second confirmed case of COVID-19 in Bauchi State.
Thank you for joining us. Well, the Bauchi State government yesterday gave the directive for all markets to close. And we are here in one of the biggest markets in Bauchi State, the Central Market. And it doesn't seem like people are complying to that directive. Many of the traders that we spoke to said they decided to come out because the government hasn't made any provision for them before asking them to stay at home. Many of them claim that they live hand to mouth and cannot afford a day's meal if they do not come out. Overall, it doesn't seem like people are taking this global pandemic seriously in this part of the country. Well, this may be because Bauchi State has recorded only one case of the virus, and perhaps people will begin to take it seriously when more cases emerge. We have been told that the governor is in a stable condition and he received the news of his brother's kidnap in good faith, hoping that he will return in good condition. Yesterday, the Nigeria Air Force Hospital donated a ventilator to the Bauchi State government to help fight the coronavirus. And a ventilator basically is a breathing machine that helps patients breathe properly or those who cannot breathe on their own. This will be kept in the intensive intensive care units to help manage any severe case of the coronavirus. Hajara Aliu, Channels Television News.
To Bayelsa State, where the House of Assembly has suspended all legislative activities for the next 2 weeks in line with the state government's efforts to prevent the COVID-19 spread. A statement by the Speaker, Honorable Abraham Inogbere, says members are also in touch with the executive arm of government to provide legislative assistance to mitigate the spread, while also calling on all residents to remain calm and report suspected cases to relevant agencies. Also, the University College Hospital, UCH Ibadan, the Oyo State capital, says one of its consultants and 4 other health personnel are in self-isolation following their exposure to a suspected case of COVID-19. Currently in isolation at the hospital, Oyo currently has 1 confirmed case of COVID-19 in the state. That's according to the Nigeria Center for Disease Control, NCDC. Now, let's take a look at the World Health Organization's website, which is live, and each moment, depending on what part of the world you are, it has regular updates about the spread of the pandemic. Now, the number of cases, the number of deaths, the recovery efforts across board are all there. And from what you can see, those figures keep ticking in. Over 400,000 there confirmed cases globally, and the number of deaths, as you can see, also the number of countries, about 197 with those cases. Now, the World Health Body is still maintaining a risk assessment of COVID-19, a pandemic, a threat to the level of very high. When you take a closer look, that's a picture of the global figures, and indeed the colors there used to highlight where it appears to be prevalent. We can also take a closer look at some of the numbers in real time, and the website has more information as to advice for health workers, your questions answered, and also some myth busters. But let's hear from the Director General of the World Health Organization on key actions that governments can take.
Second window of opportunity. The question is, how will you use it? There are 6 key actions that we recommend. First, expand, train, and deploy your healthcare and public health workforce. And second, implement a system to find every suspected case at community level. Third, ramp up production capacity and availability of testing. Fourth, identify, adapt, and equip facilities you will use to treat and isolate patients. Fifth, develop a clear plan and process to quarantine contacts. And finally, number 6, refocus the whole of government on suppressing and controlling COVID-19.
Mr. Tedros Ghebreyesus' message to the world. In the southeast, back in Nigeria, there is no confirmed case of COVID-19. However, state governments are taking precautionary measures. Let's take you to Anambra State, where our correspondent Joy Odinye brings us this update.
Welcome to Anambra State. The weather is a bit hot, but clement, and that may account for the business activities going on here and there. And that is not to say that the people are not aware of the COVID-19 pandemic. They are, but according to them, life must go on. And in Anambra State, there is no record of any case of COVID-19 pandemic. But the state is not leaving any stone unturned in ensuring that there is no spread should it happen. And it started with the state governor, Willie Obiano, having a state broadcast on Monday, trying to encourage people to ensure that they adhere strictly to sanitation and also to social distancing measure. And then to the State House of Assembly, the Speaker has suspended plenary for some weeks, also in compliance to social distancing measure. And the Ministry of Transport has taken it all out to ensure that public transport operators that are coming into Anambra State are properly checked. they check their manifest, they check whether they have hand sanitizers, and the commissioner himself also carried out proper checks on people with a temperature reading device. That's all we have from Anambra State, and it's over to you there in the studios.
Well, in Lagos, especially the Ikorodu area, our correspondent, Yomi Otagbe, is out and about. Yomi, what can you tell us? What's happening in Ikorodu this evening, considering the restrictions in Lagos today?
Thank you, Millicent. I'm at the garage area in Ikorodu. Ikorodu is a densely populated area in Lagos State. If we go by the 2006 population census, Ikorodu is supposed to have over 500,000 people, but there are other estimates that put it at over 1 million or 2 million. So right here, this area we have a lot of shopping complexes. I could see, if you look at my right, you can see that some are closed and some others are still open for business. So the situation here is that a lot of people are still congregating. So if you talk about social distancing, it's not happening here. I can see some people wearing hand gloves, wearing face masks, fine. But if you look at, around me here, you can see that a lot of people are still together. They are not, following the social distance order. And with the population here, you would think that it's business as usual, because a lot of people have been told, for instance, the level, up to level 12, with the Lagos State Ministry of Lagos State government, workers under the Lagos State government ought to be at home. But there are lots of people here, still going about as if, it's business as usual. We can see some of them selling, doing petty trading, selling food, selling rice, selling mangoes. But what the government will need to do is to look at this area. If you look at on my right, you will see a lot of people, we can see beggars, everyone still sitting together as if, nothing is happening. So
thank you. We'll see you back here in the studio. Thanks a lot, Yomi, there from Ikorodu. Finally, just because we're running out of time, in a few seconds, is social distancing possible in the marketplace?
Yes, social distancing is doable and it's possible in the marketplaces. The Traders Association, they have an already existing structure.
And they can enforce that.
Yes, and they can enforce that.
Thank you, Dr. Anna Kuma, a public health expert. Thank you for joining us.
Thank you for having me.
And indeed, we'd like to hear from you. Twitter at us at Channels TV, #COVID-19 special edition. We have our next episode at 9. Thank you for watching. I'm Millicent Walker.